Thank you, Madam President. Colleagues, Senate Bill 97 is a very important bill. It's going to assist our state in improving our health care delivery system to meet the needs of our ever-growing and changing population here in Oregon. Oregon, you know, is a wonderful place to live, and we have to continue to work to keep Oregon a great place to live. We have a very diverse population, and Oregon's population is continually becoming more diverse. Where 20 years ago, 1 in 10 people in the state identified them as non-white, today it is 1 in 5 people who identify themselves as a member of a community of color. 1 in 3 children under the age of 18 is a person of color. This cultural diversity is not geographically limited to the Portland metro area or even the I-5 corridor. Hood River, Jefferson, and Klamath counties and others have significant diversity in spite of their smaller population size. Change is happening, and we have to adapt to that change. The state of Oregon's 2010 census has shown that minority populations is 13.5% statewide. We have increased 6.5% since the year 2000. In my Senate district alone, the minority population has increased over 13%. In House District 49, the minority race population is 24%. And in House District 50, the minority race population is 18%. Change is happening, and we have to adapt. But we are really not paying as much attention to our health care delivery system. We do have diversity in this state, and we must be sure that our health care delivery system meets this need no matter who or where the person comes from. It is very well documented, and there's long-standing research that health inequities exist among our minority population. Because of Oregon's rapidly increasing cultural and linguistic diversity, we need to establish a systemic approach to achieving the long-discussed goal of a culturally competent healthcare workforce. And Senate Bill 97 starts us down that road. Recently, more data is showing that health inequities exist in populations that experience mental illness, disabilities, and within sexual minority communities. A large body of published research shows significant race-based inequities in access to routine medical procedures, cardiac medication, coronary artery bypass surgery, dialysis, and kidney transplantation, quality of basic clinical services, intensive care. I could go on and on. Our healthcare delivery system has to keep up with our changing population, and we have to have a health system that meets the needs of all Oregonians, no matter what the minority status they may have. I'm now giving you the reasons why we need this bill, and now I'm going to tell you what the bill actually does. The bill directs the Oregon Health Authority to develop standards for continuing education in cultural competence for licensed healthcare providers. This means all cultures, economic status, race, ethnic backgrounds, disabilities, religion, gender, and sexual orientation. Licensing boards don't have the time to do this, to do the research. They don't have the expertise either, but they may want to have this information to share with the licensed professionals. This is a key element of the legislation. The Office of Multicultural Health and Services in the Oregon Health Authority will be developing the standards, and they will do the literature search. They will gather the information, and then only if a licensing board wants to consider offering their licensees the opportunity to educate themselves, they have the information to do it. We need our providers to know that the health inequities exist among these populations. And we need our providers to have the skills to effectively care for patients from these very diverse cultures, languages, groups, and communities. I know the doctors want it, and for sure the nurses want this expertise, and I know the social workers want We cannot discriminate in our healthcare delivery system. It's not right, it's not moral, and discrimination cannot be tolerated. And our providers need the skills, and they want to have these skills to address the potentially diverse health needs. Let me be clear, it does not mandate any licensing board to implement any rules for their licensees on continuing education for minority status. It does not require participation in continuing education for minority status. And it does not require participation in continuing education in cultural competence. But if the licensing boards decides to implement rules on cultural competence, they need to collaborate with the health authority in developing the requirements. The bill also directs the Oregon Health Authority to evaluate the costs and logistical issues associated with developing and establishing requirements for the continuing education and look at any operational issues. With this piece of legislation, it will allow the state of Oregon to receive funds from other sources. It could be federal dollars, it could be private foundation dollars. This bill would allow the health authority to move the funding to licensing boards and other entities for implementation of cultural competence continuing education. I was looking for opposition to this bill, and I had none, zilch, zero. All I could find were individuals and groups who supported this legislation. And that includes the Oregon Health Coalition, which is ARP, American Association of University Women, Oregon Nurses Association, Oregon Medical Association, Oregon Psychological Association, the Collective Health Advocacy for Rooted Latinas and Latinos and Africans, the African Women's Coalition. There are literally dozens and dozens of groups who want this bill. A psychologist who works with underserved populations has seen firsthand the injustices that have taken place by well-meaning providers who simply lack the understanding of the demographics of their client base. They just didn't know. They don't mean to be discriminatory. And there also has been inappropriate use of interpreters, numerous incorrect assumptions about a client's behavior or character, difficulties in communication, a lack of respect, and treating people without insurance differently. There's been no sensitivity to women on occasion who only want to see a male physician due to preference or to cultural custom. One testimony is a minority woman's son was diagnosed with a terminal illness to die or maybe live 72 hours. And while waiting for the doctor, the nurse started discussing with the translator, who had a different dialect than the mother had. So the aunt started interpreting to the mother what the nurse was actually saying. And of course, the provider got so upset that she asked the aunt to leave. In that way, it was like separating mommy and baby. Mommy and baby in their particular culture are one and need to stay together. And to take away the only person that could tell her what was happening to her baby, well, this is an injustice. And it's really hard to believe. It really is inconceivable. My sister, who is 2 years older than I am, is deaf. And she is very independent like I am. But she has learned to adapt to the hearing world, even though she's deaf. Well, she had to have surgery about 10 years ago, and the hospital could not have a 24-hour interpreter. The cost was way too high. She lives back east, so I flew out there, and I spent 24/7 with her, and I demanded that I was there with her every step of the way. I demanded a bed next to her, so that she would know every step of the way what was happening to her, what she was given, and what her options might have been. The provider would have had to write everything down. And yes, that does take time. Well, I knew that the providers probably wouldn't do that, so that's why I was there. I think it's discrimination against a deaf person if a provider does not want to take the time to write on a piece of paper what the options are, or what's happening to her, or what she's being given. I stayed with my sister day and night, just because of the fear she had and the fear I had that she would not be explained what was happening to her or even what her options are. Colleagues, if you don't like parts of this bill, then tell the body what you really don't like. But if you look at the testimony presented to the committee, we didn't see any opposition. Doctors and nurses and social workers and dentists and just about every licensed health professional want this bill. There's a lot to learn, and they want the new skills, and they want to be able to care for their patients in the best way possible. There was an African youth who felt a strong stomach pain and almost lost consciousness. And desperately, his friend called 911 for an ambulance. And then when the ambulance arrived, his friend saw the paramedic coming for him, and he reacted against it, not wanting to enter the ambulance. In his culture, if he had gotten into the ambulance, that meant he was going to die. Colleagues, we have to address the variety of health disparities that exist among our very diverse population. The Multicultural Task Force and the Oregon Health Authority can do this. Our world is ever shrinking. America is a country of many races and cultures, and we should celebrate and embrace our diversity. Please vote for Senate Bill 97. Thank you, Madam President.